The next bill we have for consideration is House File 2153. So I'll move it so it's before the committee, and House File 2153 will be laid over for possible inclusion in our Human Services Finance Bill. Representative Moller, I don't have amendments, so to your bill.
Thank you, Madam Chair and members. Hopefully this will be pretty straightforward. So House File 2153 is a bill that continues to address the growing need for independent living facilities for those with disabilities. Last year, with the bipartisan help and support from Chair Schultz, along with Senator Abler in the Senate, the previous Elderly Waiver Grant Program was changed to the Customized Living Quality Improvement Grant Program. And this new grant program has been expanded to include BI and CADI waivers to provide more access to individuals in need of assisted living facilities. CADI and BI facilities will be able to access funds from this grant program for the first time this year, which is why it is vital to fund this program adequately. With a larger pool of applicants, more money is needed to continue the success we've seen in providing living services to Minnesotans who need it the most, saving the state money by avoiding nursing home costs. House File 2153 appropriates $2 million over the next 2 years to make sure that providers can continue to provide alternative, higher quality of life options for residents within the independent living community. Members, there is a handout in your packet, and also I have one testifier, Madam Chair, Lorianne Granados from Accessible Space.
Thank you, Representative Moller. So to the testifier, Lorianne Granados, welcome to the committee. Please state your name and affiliation and then proceed with your testimony.
Good morning, Madam Chair and members of the committee, and thank you, Representative Moller, for your support. For the record, my name is Lorianne Sarafolian Granados. I am the Director of Human Resources for Accessible Space Incorporated, ASI. ASI is a Minnesota nonprofit founded in 1978 to meet the needs of a friend who had broken his neck and found out there were no independent living facilities for adults with disabilities. And so he moved into a nursing home until there were. Today, we provide customized living services in apartment settings for more than 100 Minnesotan adults with significant physical disabilities from Rochester to Duluth. We provide extensive physical cares and medication assistance 24/7. That 24-hour access to care allows our clients to live in the community with dignity and self-determination at a fraction of the cost of nursing home placement. The problem is we only serve low-income residents. 98% of our service residents are Medicaid recipients, and their care is funded through the CADI and brain injury waivers. This disproportionate percentage of waiver clients creates a tremendous financial burden for us. As you may know, the waiver rates are quite low compared to the cost of care. The rates are nowhere near proportional to the rates paid for DD services, but more importantly, the waiver rates don't reflect the level of care or the degree of staffing needed for the clients we serve. The rates in 2019 resulted in a $450,000 deficit in this fund for us, and that was after a $320,000 deficit in 2018. But the waiver rates haven't increased for more than 7 years, so we're really trying to pay 2021's expenses with 2013 budgets. Since we don't serve any private pay or insurance clients, there is no other group to shift these unreimbursed costs to. That has made it really difficult for us to continue these critical services. In fact, the only way that we continue to provide these services is to subsidize this fund with revenue from other services in other states. Absent ASI services, most of our service residents would reside for years, for the rest of their lives, in a nursing home at a much higher cost and at a significantly diminished quality of life. ASI services prevent nursing home admission, which benefits the individual, their families, and the Minnesota taxpayers. We have so many vital, involved, active residents who have complex 24-hour needs that simply could not live and thrive in another setting. But customized living allows them to access 24-hour care that they need with the freedom and independence of their own apartment. We have a resident in Duluth who has quadriplegia and is on a vent, and he lives in his own apartment, attends classes at UMD virtually, watches Gopher games with his girlfriend in his apartment. I just cannot imagine him living in a nursing home. Last year, With the help and support of Senators Abler and Hoffman in the Senate and Representative Schultz in the House, this elderly waiver grant program was changed to become the Customized Living Quality Improvement Grant. And that allows expanded eligibility to brain injury and CADI providers who serve disproportionate populations of waiver recipients. CADI and brain injury providers will be able to access these funds in the grant program for the first time, which is why it's so vital to fund this program. It will really make significant impact in the lives of our clients by filling a funding gap that will allow us to secure the staff so critical to serving the residents and realizing our mission until we can rectify the problem with the waiver rates. I thank you so much for working together with us to resolve this issue so that we can continue to provide services in Minnesota. And with that, Madam Chair, I thank you.
Thank you, Ms. Granados. Do we have questions from members to the bill author or to the testifier? I'm not seeing questions. Representative Moller, closing comments?
Thank you, Madam Chair, and thanks to Ms. Granados for your testimony and for the work you do. And thank you, Chair Schultz, for hearing this bill, and to the members. I appreciate your support.
Thank you, Representative Moller. So with that, members, House File 2153 will be laid over for possible inclusion in our Human Services Finance Bill.